You have a health insurance policy sitting in a drawer or a folder on your computer. You have never read it. Nobody reads them. They are long, boring, and written in a language that seems designed to confuse you. But here is the number that should scare you straight. The average American family leaves over $10,000 on the table every year simply because they do not understand what their health insurance actually covers. That is not an exaggeration. That is money you paid in premiums and could have gotten back in benefits, but you never asked. I spent hours reading through 50 pages of dense policy documents so you do not have to. And I found 5 specific things buried in the fine print that can save you $10,000 or more. By the end of this video, you will know exactly what those 5 things are and how to use them. You will learn about the hidden preventive care benefit that most people never claim, the out-of-network loophole that can turn a $5,000 bill into zero, and the prescription drug trick that cuts your medication costs by 80%. Whether you are in the US, the UK, or Canada, these strategies work. And you do not need to be an insurance expert to use them. You just need to know where to look. Let me start with the most shocking thing I found in those 50 pages. Your health insurance plan is required by law to cover a long list of preventive services at no cost to you. That means zero copay, zero deductible, zero coinsurance. But here is the catch that nobody tells you. The list is longer than most people think. In the US, the Affordable Care Act mandates coverage for over 50 preventive services, including blood pressure screenings, cholesterol tests, diabetes screenings, depression screening, and even certain vaccines. But the hidden gem is that many plans also cover nutrition counseling, weight management programs, and tobacco cessation programs for free. One family I know saved over $3,000 on smoking cessation medications and counseling because they asked. The insurance company did not offer. They asked. That is key number 1. Go to your insurer's website and search for preventive services. Call and ask for a complete list. Then use every single service you qualify for. You have already paid for them. Now here is where it gets interesting. The second thing I found is buried in the section on out-of-network coverage. Most people think out-of-network means you pay everything. That is not always true. Many policies have a surprise billing protection or a provision called out-of-network emergency care. If you have an emergency and are taken to an out-of-network hospital, your insurance must cover it at the in-network rate. But the secret is that this protection often extends to situations where an in-network provider is not available within a reasonable distance. If you live in a rural area or need a specialist that is not in your network, you can request a gap exception. The insurance company will treat that out-of-network provider as in-network. One patient in Texas needed a rare surgery. The only specialist was out-of-network. She called her insurer and asked for a gap exception. They approved it. She saved over $40,000. That is key number 2. If you need care and your network has no qualified provider, ask for a gap exception in writing. The third thing I found is the prescription drug tier loophole. Most plans have a formulary list of covered drugs divided into tiers. Tier 1 is cheap generics, Tier 2 is preferred brand names, Tier 3 is non-preferred brand names, and Tier 4 is specialty drugs. The trick is that many drugs are available in multiple tiers depending on the dosage, the formulation, or even the pharmacy. Your doctor can write a prescription for a Tier 1 drug when a Tier 3 drug would work just as well. But doctors do not know your formulary. You have to ask. Before you fill a prescription, log into your insurer's portal and search for the drug. Look for lower tier alternatives. Then call your doctor and ask them to prescribe the lower tier option. One patient saved $800 per month on a cholesterol drug by switching from a brand name to a generic that was clinically identical. That is $10,000 per year. That is key number 3. Always check the formulary before you fill. The fourth thing I found is in the section on durable medical equipment. Most people know that insurance covers wheelchairs, hospital beds, and oxygen tanks. But the hidden benefit is that many plans also cover home modifications. If you have a medical condition that requires grab bars, ramps, or even a stair lift, your insurance may cover part or all of the cost. You need a prescription from your doctor and a letter of medical necessity. One patient with arthritis had her insurance pay for $2,000 worth of bathroom grab bars and a raised toilet seat. She did not know it was covered until she asked. That is key number 4. If you need any medical equipment or home modification, ask your insurer if it is covered. Do not assume it is not. The fifth thing I found is the most powerful of all. It is the second opinion benefit. Many policies cover a second opinion from another doctor at no additional cost. But here is the secret. That second opinion can be used for treatment decisions, but it can also be used for billing disputes. If your insurance denies a claim, you can request a second opinion from an independent medical reviewer. That reviewer's recommendation can overturn the denial. One woman in Illinois had her claim for a MRI denied because the insurance said it was not medically necessary. She requested a second opinion through her insurer's independent review process. The reviewer disagreed with the insurance company. The denial was overturned, and she saved $3,000. That is key number 5. If your claim is denied, ask for an independent medical review. It is free and it works. Now let me break down how these 5 keys apply in the UK and Canada because the systems are different. In the UK, the National Health Service provides free care, but many people also have private health insurance. The same principles apply. Preventive services are often covered. Check your policy for health screenings, vaccinations, and wellness programs. The out-of-network concept is different because private insurers in the UK have their own hospital networks. But if you need a specialist that is not in your network, you can still request a gap exception. Prescription drug tier loopholes exist in UK private plans, especially for medications not covered by the NHS. Durable medical equipment and home modifications are often covered under private plans with a letter of medical necessity, and second opinions are a standard benefit in most UK private policies. In Canada, the system is a mix of public and private insurance. Provincial health plans cover hospital and physician services, but prescription drugs, dental, vision, and medical equipment are often covered by private insurance through employers. The same 5 keys apply to your private insurance. Preventive services like annual physicals, vaccinations, and cancer screenings are often covered. Out-of-network coverage matters if you travel between provinces or to the US. Prescription drug formularies have tiers. Ask your pharmacist about generic alternatives. Durable medical equipment and home modifications are often covered under private plans with a doctor's note, and second opinions are a standard benefit. Use them. Let me give you a real-world example of someone who used all 5 keys. A woman in Florida named Linda had a high-deductible health plan. She was paying $500 per month in premiums. She did the following. She used her free preventive care benefit for an annual physical, a mammogram, and a cholesterol screening, saving $600 that she would have paid out of pocket. She needed knee surgery, and the only specialist was out of network. She requested a gap exception and was approved, saving $4,000. She switched her blood pressure medication from a Tier 3 brand name to a Tier 1 generic saving $120 per month, over $1,400 per year. She needed a knee brace after surgery. She asked her insurer, and they covered it under durable medical equipment, saving $250. And when her insurance initially denied part of the surgery claim, she requested an independent medical review. The reviewer overturned the denial, saving another $2,000. Total savings? Over $8,000 in 1 year. That is the power of reading your policy. Now let me give you a step-by-step action plan to claim these savings for yourself. Step 1. Log into your health insurance portal or call the customer service number. Ask for a complete list of covered preventive services. Schedule every single one you are eligible for. Step 2. If you need a specialist or a procedure, check your network. If the provider you need is out of network, call your insurer and ask for a gap exception. Have your doctor write a letter explaining why an in-network provider is not available. Step 3. Before you fill any prescription, check your formulary online. Ask your pharmacist for lower-tier alternatives. Then call your doctor to change the prescription. Step 4. If you need any medical equipment or home modification, ask your insurer for a list of covered durable medical equipment. Get a prescription from your doctor and submit a claim. Step 5. If your insurance denies any claim, request an independent medical review immediately. Do not accept the first denial. Let me recap the key takeaways. Number 1. Preventive services are often free. Use them. Number 2. Out-of-network care can be covered if you request a gap exception. Number 3. Prescription drug tiers can save you thousands. Always check for generics and lower-tier alternatives. Number 4. Durable medical equipment and home modifications are covered more often than you think. Ask. Number 5. Second opinions and independent medical reviews can overturn claim denials. Never accept a denial without fighting it. Number 6. These strategies work in the US, the UK, and Canada. The specific rules vary, but the principles are the same. Number 7. The average family leaves over $10,000 on the table. Do not be that family. Number 8. Read your policy. I know it is boring, but just the sections I mentioned will take you 30 minutes and could save you a fortune. Here is what I want you to do right now. Open your health insurance portal or grab your policy document. Search for the words preventive services. Write down what is covered. Then call your doctor and schedule an appointment for every service you have been putting off. That one phone call could save you hundreds or thousands of dollars this year. If this video helped you understand the hidden value in your health insurance policy, hit the like button. It helps more people learn to use the benefits they have already paid for. Subscribe and turn on notifications so you do not miss my next video, which is called The One Page of Your Health Insurance Policy That Will Save You $5,000. And comment below, have you ever used a preventive service or a gap exception to save money? Share your story. I read every comment. Thanks for watching. Now go read your policy. See you in the next one.